Okay, I think we are live. If there is any issue with the audio and video, just write in the comment section. Otherwise, I'll proceed in this today's session. Okay, so we just got to go ahead. Okay, so once again, good evening everyone. Myself, Dr. Rijul Agarwal. I'm the Orthodontic faculty at DAMS. So today I'll be taking a session on your upcoming INICET exam scheduled on 17th of this month. Okay, I hope most my viewers we are safe and sound and are focusing on their studies rather than focusing on postponement of the exam and making such signing such petitions. The government agencies are themselves well versed and well aware if the situation arises as such whether to go ahead or postpone the exam. You need not worry about that. There are people who are more capable, more alert right now to focus on such issues. Your only aim right now should be to study and get ready for this exam. Okay, so based on current scenario, I think it will go as per schedule on 17th only. Rest all the updated and correct information these days only directly comes from the government sources. Okay, so without wasting any further time, we'll begin with this today's session. So most of my questions, or I can say all, are the PYQs of the previous INICET exams. As I've repeatedly told my students over various groups, INI का basic जो आपको start करना है, तो you should be thoroughly well versed with the PYQs of the last 10 years minimum of the dental side. Dental INI CET paper of the last 10 years should be thorough with you. Okay. It was till I think 2020 2021. It was before that AIMS and PGI, and we used to conduct separate exams. So likewise PGI papers should also be thorough with you for the last 10 years when they were separately occurring. Okay, so moving ahead with today's discussion. First question. So according to CATS, the image shows first type of malocclusion. So a very common type of question. Roughly every alternate or SO exam asks question about the classification of malocclusion, and उसमें भी सबसे ज़्यादा common और सबसे ज़्यादा popular is this CATS premolar classification system. Okay, either in the form of image based or direct theoretical form, they ask you this question. Okay, so class 1, class 2, H2H or class 3. Okay, so as I've repeatedly told before as well, I'll again repeat. Okay, in CATS premolar classification, if they have given you an image, okay, this time whenever this question came, there was a lot of confusion, okay, regarding, because the image was showing some sort of end-to-end end-on relationship or H2H relationship, but these line diagrams, they highlighted somewhat a different picture. So students, please be careful whenever CATS premolar classification will come in the image based form. This line will be definitely be there. You don't have to go with the cuspal relationship which is shown in the image. Rather, you have to follow this line pattern which is shown. Whether it's ahead, the upper line is ahead, behind, or coinciding. Okay. So the correct answer was class 2 malocclusion. At that time, a lot of confusion, or you can say, was created because the cuspal relation was H2H. No, we don't have to follow the cuspal relation. You have to follow this line diagram which is shown in the CATS premolar system of classification. Few other points. It's a quantitative method of classification. Quantitative means not only it classifies into class 1, 2 and 3. It tells you how much it is class 2, class 3 or class 1. Class 1 will be 0. So how to measure it? Just need to place a ruler and measure the distance between this line, whether it's plus or minus. Okay, so good evening once again, Nikesh. So this is the CATS premolar classification system given in the year 1992. It was given by Morton CATS. Okay, so class 1 when these lines are coinciding, class 2 when the upper line is ahead of the lower line, and class 3 when the upper line is behind the lower line. Okay, so this was the first type of question. Okay, I have handpicked a few important questions which you should or must know. Okay, for my discussion of today. Okay, next, which of the following inhibits bone resorption? So in the previous lecture also, where all the faculties joined, the INI or particularly AIMS people have a particular affinity towards biomarkers. Most of the researchers there is focused on developing or identifying good evening RIDs. Okay, good evening once again. Okay, so as I was telling, most of the research was classified, or you can say centered towards biomarkers. So these biomarkers are not only important from your biochemistry and pathology and oral pathology point of view, they are also important in orthodontics as well. Okay, so एक biomarker का question you can expect, and don't expect कि कोई हाई-फाई बिल्कुल मुश्किल सा एक बायोमार्कर पूछ लेंगे. Okay, sometimes they ask you a minimal easy or sometimes that kind of a question. Okay, so which of the following inhibits bone resorption? Interleukin 1, interleukin 6, parathyroid and OPG or osteoprotein. So the correct answer is, yes, you are right, it's osteoprotein. Okay, so it inhibits bone resorption, and what promotes is rank. You all know about competitive, non-competitive inhibition, how they bound to it. We are not going to discuss right now that. Most important for you to right now know is about these biomarkers. Okay, next is important point is interleukin 10 down regulates rancor. Okay, another point is activity index. This was asked in, I think, 2017 May, I think, or December. They asked in the AIMS paper, that time it was separate, they asked you about activity index. If you have undergone or gone through the previous year's question, you would have seen this word activity index. It's just a ratio of the rankle OPG. Okay, so अगर activity index करके question आए, so activity index is a ratio of ankle divided by OPG. Tells you about the, जिसका रेशियो अगर ऊपर होगा more than 1 means bone resorption है, कम है तो bone deposition. तो उसके अकॉर्डिंग टूथ मूवमेंट स्लो होगा या फास्ट होगा. अगेन अगर मैं इसी क्वेश्चन को घुमाना चाहूँ, विच ऑफ द फॉलोइंग इनहिबिट्स, हियर दे आर आस्किंग अबाउट इनहिबिट्स बोन रिजॉर्प्शन, तो विच ऑफ द फॉलोइंग स्लोज टूथ मूवमेंट, स्लोज डाउन टूथ मूवमेंट. इसी क्वेश्चन का एक और वैरायटी होगा. So they can ask you in this form as well, slows down tooth movement, increases tooth movement, fastens tooth movement. Okay, just be careful. Question same है, concept same है, just question को twist कर दिया. तो जो inhibit करेगा bone resorption वो tooth movement को slow कर देगा. Okay, so just be careful. And next, activity index. Next question, normal lips not able to meet due to proclined upper maxillary anteriors present in class 2 Div1 pattern. Patients are called as, so they have a competent lip, incompetent lip, potentially competent or potentially incompetent lips. A very easy question, if anyone can answer this. So the lips are not able to meet due to proclined maxillary incisors. So that means if had the incisors not been proclined, they would have been able to meet. Okay, so yes, you're all right, potentially competent lips. Okay, so there is no terms as such as potentially incompetent lips. ओके सो ये तो हो गया इजी क्वेश्चन. अब क्लास 2 डिव 1 एंड क्लास 2 डिव 2 के पैटर्न के रिगार्डिंग देयर आर फ्यू पॉइंट्स विच यू शुड बी अवेयर. ओके, हाइपर एक्टिव मेंटालिस मसल एक्टिविटी किसमें होता है? if you remember the table which we discussed in class, the differentiating points between class 2 div 1 and class 2 div 2, the most common pathognomic feature, the most common clinical feature of class 2 div 2, hyperactive mentalis किस पे होता है, everted lips किस में होता है, this all should be known to you. A very very common and differentiating point of view between these two types of malocclusion. Okay, so class 2 div 1 and class 2 div 2 में, and class 3 में what you should be aware about is pseudo class 3 and true class 3. Pseudo and true class 3. Okay, so this is a quick short revision and the type of questions which you can expect on this class 2 div 1 and class 2 div 2 and class 3 type of malocclusion. Next question. Twin block appliance is used in the management of anterior cross bite, posterior open bite, posterior cross bite or deep bite. Now the reason which I picked up this question is, first of all I will wait for you to answer, then I will tell you the reason. So if anyone can answer those. Okay, you said 3. We are on the, I think, the 4th question. The twin block appliance is used in the management of anterior cross bite, posterior open bite, posterior cross bite or deep bite. Someone says posterior, Nikesh says posterior open bite. Anyone else can answer? Otherwise we'll begin the discussion. Okay. So twin block and any such appliances are cataracts and comes under the myofunctional appliances. Once again, images of these appliances are very very important. You should be well versed and thorough with the images of these appliances. Next, now these appliances, I have told you, are used for correcting skeletal malocclusions in growing children based on their CVMI and skeletal maturity indicators. Okay, now the question के जो options है उसमें कहीं भी class 2 malocclusion नहीं दिया गया है, class 3. Like when you anterior cross bite, posterior open bite, posterior cross bite or deep bite. Okay, so now if you say posterior open bite, now they are not used for the management of posterior open bite. Okay, why? Because posterior open bite generally is due to the reason of tongue thrusting habit. So giving a twin block appliance won't be able to correct this open bite. Okay, rather you can say they are used for the correction of deep bite. How? So by trimming the blocks of the twin block, we encourage the eruption of the posterior teeth. Eruption of posterior teeth. Okay, so the posterior teeth are encouraged to erupt so as to correct the anterior deep bite. So as I was telling, why I picked up this question was, as I told you, twin block can also be used to correct class 3 skeletal class 3 malocclusion as well. So in that way, when this question came, some students asked me why not anterior crossbite as well, because anterior crossbite is also commonly found in skeletal class 3 malocclusion. So students, anterior crossbite correct is most commonly found in skeletal class 3 malocclusion. Lock is not used to correct here, because here the examiner is not pointing you it towards a skeletal crossbite. It's just writing anterior crossbite. And as I've already told you, in your exam we don't have to select the correct option, we have to select the most appropriate option. Okay, so out of all this, can say the most appropriate answer here would be D written. Had D not been there, then you could have gone with anterior crossbite. Okay, I hope I am clear with this. Okay, so moving ahead. So इसमें क्या important है, the bite planes lock at 45-degree angle. Okay, and the lower molars are kept free for the eruption if needed in correction of deep bite. Okay, again anterior cross bite correct करने के लिए या inclined planes are there. Okay, Catalan supplines अभी recently conducted नीट एग्जाम में भी Catalan supplines पे क्वेश्चन आया है. Just be careful, उसकी image not should be well versed and thorough. Okay, next question. Basic function of mini implant is primary stability, type of anchorage, type of material use, osseointegration. Right now जब हम ये ऑर्थो करके सब्जेक्ट डिस्कस कर रहे हैं, व्हेन आप सबका दिमाग जैसे ही मिनी इम्प्लांट आएगा पॉइंट्स टुवर्ड्स टैग्स. नाउ द क्वेश्चन, जब प्रॉब्लम शुरू होती है, जब ये क्वेश्चन एग्जाम में आता है, जहाँ 200 क्वेश्चन है एंड योर माइंड इज जगलिंग बिटवीन वेरियस सब्जेक्ट्स. ओके, सो यहाँ टर्म जब मिनी वर्ड यूज़ किया है, मिनी मतलब टैग्स या टेम्परेरी एंकरेज डिवाइस की तरफ ही पॉइंट किया गया. They are not prosthetic implants, they are orthodontic implants. Okay, तो जल्दबाजी में जस्ट फ्लो में इम्प्लांट वर्ड यूज़ किया एंड ऑस्टियोइंटीग्रेशन या ऐसा कुछ लगा दिया, सो इट विल बी इनकरेक्ट. सो द करेक्ट आंसर, yes you are right, it's a type of anchorage. So the reason why I picked up this question is to highlight the importance of stressing the importance of reading the question thoroughly. You have 45 minutes or so for each section, so read the question carefully. So it's a skeletal anchorage device. Here its image. Diameter, length, you are all well aware of. Okay, next very important question. Loin joining pogonium to subnasal to nasal is called as. Soft tissue lines पे every exam has a question from orthodontic point of view on soft tissue lines. Z line, S line, R line, E line. Okay, so the correct answer here is S line. So S line is from soft tissue pogonium to the midpoint of the S-shaped curve between subnasal and nasal tip. Okay, now exam में इन्होंने पूछा था subnasal, और S line जो पास होती है, this is the upper lip, टिप ऑफ चिन से दिस एस शेप कर्व को बाइसेक्ट करते हुए, एंड बाकी ऑप्शंस को देखते हुए दीज आर ऑल एलिमिनेटेड. द बेस्ट ऑप्शन और मोस्ट अप्रोप्रिएट हियर वुड बी एस लाइन. सो इधर यहाँ रिकॉल में कुछ प्रॉब्लम हुआ है उस टाइम पे, और द क्वेश्चन हैड कम लाइक दिस ओनली. सो द बेस्ट और मोस्ट अप्रोप्रिएट आंसर हियर वुड बी एस लाइन. Okay, Z line is tangent to the soft tissue chin and to the most anterior point of either upper or lower lip, whichever is proclined the most. E line, tip of nose to soft tissue chin, and H line tangent to the chin and upper lip. So this is a very important question from your orthodontic, you can say, revision point of view right now. Soft tissue lines. Okay. I hope I am clear and stress the importance of this soft tissue lines. Next, temporalis muscle on coronoid process acts as capsular matrix, periosteal matrix, microskeletal unit or microskeletal unit. Last INI के पेपर में there were I think 4 to 5 questions on the topic of growth and development from ortho. Okay. So this is the most, I can say, the most boring and the most ignored topic from orthodontics. And last INI exam I think they minimum 4 questions were there from on this subject. Okay, so this is related to the your functional matrix hypothesis or theory, the theories of growth. Direct question from there. Okay, so yes, the correct answer is option B, that is periosteal matrix. Okay, so it acts directly and actively upon the related skeletal unit and brings about secondary compensatory changes through bone deposition and resorption. Okay, a very easy and direct question. Okay, next question, bilateral cleft lip occurs due to the failure of fusion. I think every exam is asking this question, that's why I picked it up. Problem related to cleft lip and palate. So I did not think about waiting for you to answer this. I think by now everyone is aware of the answer of this question. It is due to the frontonasal and the medial nasal process. This is the diagram. Okay, so what I want to discuss with you is this Haberman feeder. So this is a special type of feeder, okay, or a bottle named after its inventor Mandy Haberman for babies with impaired sucking ability. Okay, for example, in patients with cleft lip and palate or Mobius syndrome. Okay, so design is stimulated to simulate breastfeeding. So in patients जिनमें palate there is a cleft in the palate, so अगर normal feeder से if you put, the milk will go inside the nose. So this feeder is specially designed with an elongated nipple, so that the milk directly goes inside the throat and there are less chances of regurgitation through the nasal cavity. Okay, so this is the Haberman feeder. इसका image name, just be thorough and just remember it, because it can come as an image based question or a theoretical question, which kind of feeder or which kind of feeder is prescribed to patients with cleft lip and palate. Okay, so I'll move ahead. Next question on CVMI staging. Again, a question of skeletal maturity indicators. I think every exam is asking you about it, either directly or through a long theoretical type of question. The accelerated or peak mandibular growth corresponds to which of these stages? Last in NEET they asked you in the form of image based question, in which there was some confusion regarding the presence or absence of concavity, किस border पे है, किस पे नहीं है. Okay, so to summarize, just be careful, just look at the lower border of C2 C3. Concavity है नहीं है या accentuated concavity. अगर accentuated या deep concavity है तो means STVMI 4-5 के beyond है. अगर slight सी concavity है या flatness की तरफ है तो 2-3-4 की तरफ you should go. Simple सा logic. इतने नियर बाय ऑप्शन जनरली दे वोंट गिव बेस्ड ऑन इमेज बेस्ड क्वेश्चन, जो मैंने नीट एग्जाम में भी रिकॉल में भी डिस्कस किया था. अगेन आई एम हाईलाइटिंग द सेम पॉइंट. Okay, so its correct answer is C only, CMI 3 and 4. Yeah, I understand. That's why I'm saying telling अगर image based form में आ रहा है question, just look at the lower border concavity. Okay, lower border concavity पे just keep a tab and based on this you answer it. अगर ज़्यादा डीप है या कम डीप है उसके अकॉर्डिंग. इफ इट्स मोर एक्सेंचुएटेड और मोर डीप इट्स टूवर्ड्स 4, 5, 6. इफ इट्स फ्लैट और लेस एक्सेंचुएटेड इट्स टूवर्ड्स 3 और 4, 2 और 3. ओके, okay, so that's how we as orthodontists judge a patient. We don't look at the bodies of C3 and C4 as well, because it's very difficult to, becomes very subjective. That rectangle, सब किसी के लिए वो rectangular horizontal है, किसी के trapezoid है. Just look at the lower border concavities. Again I'm saying accentuated है या ज़्यादा deep है, अगर लो या कम एक्सेंचुएटेड या फ्लैट की तरफ है, टू जज द CVMI स्टेजिंग ऑफ द पेशेंट. ओके, सो आई होप आई एम एबल टू सेटल दिस कंफ्यूजन और यू कैन से सॉल्व द प्रॉब्लम. ओके, नेक्स्ट अगर इसको और क्लियर करना है जस्ट गूगल पे जाके इमेजेस एक्सरे की देख लीजिए. CVMI की एक्सरे इमेजेस देखना, डायग्रामेटिक इमेजेस मत देखना, बिकॉज एग्जाम में आपको एक्सरे इमेजेस आती है. ओके, किसको C2, किसी को C3 बताया, CVMI 2, CS2 बताया, CS3 बताया. इट विल बिकम मोर क्लियर. द मोर इमेजेस यू लुक, दैट्स हाउ द मोर क्लियर इट विल बिकम. लुक एट द एक्सरे इमेजेस on this topic. And again I'm saying just draw or determine your correct option by looking at the lower border concavity, not at the shape, unless direct theoretical question है जिसमें shape पूछी गई है. Okay, next, so a type of question जो INI में बहुत you can say एक उसको कह सकते हैं मुश्किल बनाने का टाइप करा गया कि मल्टीपल आंसर टाइप क्वेश्चन. So as I have told you before as well, मल्टीपल ऑप्शन करेक्ट क्वेश्चन को भी वो सिंगल बेस्ट ऑप्शन में ही दे कंबाइन इट. ओके, सो विच ऑफ द फॉलोइंग स्टेटमेंट्स अबाउट क्वाड हेलिक्स अप्लायंस इज ट्रू. सो देयर आर 4 ऑप्शंस and based on it you have to select which of these statements is true. It uses wire made of 038-inch alloy, uses wire made of 038-inch SS, force applied is 100 to 200 grams, force applied is 200 to 600 grams. Okay, so इस टाइप के क्वेश्चन को अप्रोच करने के लिए बेस्ट थिंग इज टू लुक एट द ऑप्शंस फर्स्ट एंड लुक एट द स्टेटमेंट विच इज करेक्ट, विच इज नॉट करेक्ट, एंड डोंट ओनली आंसर. अगर आपको इसके बारे में कोई जानकारी नहीं है, जस्ट बेटर स्किप इट रेदर देन लुकिंग एट द ऑप्शन की नहीं फर्स्ट में AC दे रखा है, AD दे रखा है एंड ऑल दैट, तो उससे बेस्ट निकाल लो. इफ़ यू आर अवेयर अबाउट इट जस्ट देन ओनली गो थ्रू इट. इफ यू आर नॉट अवेयर इग्नोर दिस क्वेश्चन एंड मूव अहेड. ओके, सो uses wire made of 038-inch alloy? No. Made up of 038-inch SS? Yes. Force applied is 100 to 200 grams. Or last option is force applied is 200 to 600. So the best is B and D. So B and D is my option 4, which you have already told. Okay, so quad helix is a type of slow maxillary expander appliance. Important point is it's a modification of the coffin spring or W arch, which was later modified with the presence of anterior and posterior helices. Activation इनका कैसे होता है you are well aware, I'm not going to discuss. Important point is इसमें जो है newer type of expander is the night eye expander. So just look at the images of all these expander from your lectures और तो image की जो booklet आपके उस पे present है. Okay, image booklet which is already present or given to you, be present in your app. सारे एक्सपैंडर्स की बेस नाइटा एक्सपैंडर, बटरफ्लाई एक्सपैंडर, हायरैक्स एक्सपैंडर, हैश एक्सपैंडर, कौन सा बैंडेड है कौन सा बॉन्डेड है, इसकी इमेजेस जस्ट गो थ्रू डेम. नाइटा एक्सपैंडर को थोड़ा डिटेल में जस्ट गो थ्रू डेम. किसने दिया था? विलियम आर्ंट ने दिया था. व्हाट टाइप ऑफ एक्सपैंडर, व्हाट टाइप ऑफ क्लासिक conversion from A to M conversion happens. Just go through them and revise them if you haven't done so already, because NITA expander is again a very you can say popular thing among the AIMS people. Okay, more popular than Quadrillix. Quadrillix generally कम हो गया है, we still give it but less, mostly in the left patients. Okay, so moving ahead. Next question. PNAM पे pre-surgical nasoalveolar molding is done to passively keep the fragments, nasal fragments and lip segments in contact, lengthen the columella passively, pre-surgically manage the deficiencies for enhanced function and bring lip segments into contact. So again, I think the last INI question only on PNAM. सो क्लेफ्ट में दो चीज़ें, फर्स्ट एक एम्ब्रियोलॉजी, सेकंड why is this stop working? Just a minute, my marker is not working. Okay, as I was telling, cleft में I'll just wait for it. इसकी चार्जिंग खत्म हो गई है क्या? Research cleft में there are two things which are very important. First is embryology. किसके defective fusion से क्या होता है? Bilateral cleft lip, unilateral cleft lip या cleft palate alone. Next, the effect of thalidomide और teratogens किस एज पे किस टाइम पे क्या इफेक्ट करते हैं. And third, जो recent time पे they have asked you is about PNAM. Okay, so as I repeatedly told you, orthognathic, cleft and OSA. OSA more important than orthognathic in the recent time have come up, जिसमें से एक या दो क्वेश्चन डेफिनेटली क्लेफ्ट में से तो पक्का ही, एंड नेक्स्ट OSA से एक या क्वेश्चन तो आने लगा है. So just don't ignore it. I think this is working now. I think this pencil is not working right now. There is some problem. So as I was telling, just be aware cleft and next obstructive sleep apnea, that is OSA. Okay, so it is done, you are right, it is done to lengthen the columella and bring the cleft segments into a more idealistic repair before a definite surgical repair can be carried out. So as I was telling, अगर इतना defect है cleft पे and we carried out the surgery, there will be a lot of tension between the sutures and chances of relapse or failure of the surgery will be more. So passively to bring surgery is an active process, मतलब forcefully हम उसको ला रहे. So at this age, due to the presence of hyaluronic acid, the soft tissue of the child is highly moldable. Okay, because of high maternal estrogen in the bloodstream of the child. These all things are very important. We have already discussed. So what does these appliance? They passively bring the segments together and at the same time lengthen the columella or the nasal tip appropriately before an active surgery can be carried out. And why this active surgery is delayed? Because of the rule of 10. Hemoglobin level, WBC level, age 10 months, 10%, 10 gram percent hemoglobin, and all three factors. Okay, so this is a PNAM appliance. Okay, this consists of a passive plate which goes inside the mouth, and this bulb thing goes inside the nasal tip and elevates it so as to lengthen it. You can see the length, the nose is collapsed. So this thing bulging inside the nose lengthens it appropriately so as to bring about active, or you can say passive, lengthening of the column. And after that, surgical procedure, Millard's flap and Tennyson flap you could have done discussed in your oral surgery, ma'am would have told you, is done to close the segments. किस एज पे कौन सी सर्जरी होती है, किस वो is also very important. Oslo protocol, remember. Okay, next, diameter of finger spring is made twice. Effect on strength. Sorry for this interruption, this marker is not stopped. Okay, so just have to rely on orally for the remaining part of the lecture. So diameter, so next question, based on the material, you can say the wires. So remember this formula: force is directly proportional to the fourth power of diameter and inversely proportional to the cube of the length. So diameter or length का क्या variation है and the effect of strength, springiness, range is very important. Diameter को sometimes they ask you in the form of radius as well. So diameter, radius is okay, half of the diameter. So accordingly you have to mentally calculate it. You won't be provided any pen or paper in the exam hall. You will just be sitting in the front of a computer screen, mentally calculate it and answer this. Effect on the strength on changing the diameter. So this is a short summary of the change in the diameter and change in length. Okay, next is an image based question of an instrument. This is a, you can say, second or third important topic after the following which I have told you. Image of an instrument, orthodontic instrument. So again, just have a quick look at the images of the instrument. Already provided you in your app image based, your notes form वाले heading के अंदर है वो. Just go through those images of the instrument. So this is a distal end cutter. Look at the safe end wall here. So this is the image of a distal end cutter. Most commonly asked is bracket holding forceps, distal end cutter and a ligature cutter. ये तीन की इमेज तो अच्छे से पता होनी चाहिए. सबसे ज़्यादा ब्रैकेट होल्डिंग फोर्सेप या ब्रैकेट पोजिशनिंग गेज एज वेल, बूट्स गेज, चौथी ये भी. सो जस्ट रिमेंबर दीज 4 इमेजेस. अगर सारी नहीं याद है, 4 तो ज़रूर याद करके जाना, देख के जाना. ब्रैकेट होल्डिंग फोर्सेप, अगेन आई एम रिपीटिंग, ब्रैकेट होल्डिंग फोर्सेप, ब्रैकेट पोजिशनिंग गेज और एमबीटी गेज, जिसमें 2 आते हैं, ब्रैकेट एमबीटी गेज एंड बून्स गेज दोनों. तो ब्रैकेट होल्डिंग, ब्रैकेट पोजिशनिंग, डिस्टल एंड कटर एंड लाइगेचर कटर. बाकी भी याद है तो बहुत अच्छी याद है. ये 4 तो डेफिनेटली याद होनी चाहिए फॉर योर आईएनआई एग्जाम. ओके, so it's a distal end cutter capable of cutting wires up to 156 to 0.7 mm or 022 cross 028 inch. So next, inclined plane. As I was telling, inclined plane or cat hands pe to they have, I think every exam they are asking. I don't know how come it has become so popular. So Catalan's inclined plane appliance is used for the correction. So it's used for the correction of anterior crossbite. Abhi last month NEET में they asked you about this. So the most important point is it should not be used for more than 3 weeks. Why? Because it causes posterior open bite, and posterior open bite होगी तो extrusion होगा, eruption होगा, anterior bite further open हो जाएगी. So the limit or the use should be kept up to 3 weeks maximum. So constructed at an angle of 45 degrees to the maxillary occlusion plane, brings about forward movement of the upper incisors. Next, true statement about aligners is, last you can say a last important topic for your exam is aligners, especially for INI exam. Thermo-modified and plaster model, thermoformed on 3D models, CAD/CAM and directly printed. ये मैंने INI के टाइम पे भी when I took the predictor series discuss this question. What are the materials used? If anyone can answer this, otherwise. So yes, you're right. They are thermoformed on 3D models. Okay. So directly printed aligners कौन से होते हैं? First of all, जिसको नहीं याद है, just take a quick review and tell you something if कोई points miss हो गए last time से, because they are aligner point पे थोड़ा सा इस time के लिए it's important for your exam. INI. ठीक है. So what are the material used for aligner manufacturing? So these are the following material. PET-G, it was earlier used. PET-C, earlier used. Now the most common material which is used is thermoplastic polyurethane, TPU या PU. Okay, aligner sheets come, they are directly thermoformed or thermopressed on a 3D printed model. Okay, and directly 3D printing of the aligner. So directly 3D printing of the aligners is done for shape memory aligners. Just remember this word, shape memory aligners are the only aligners which are directly 3D printed. The rest all aligners are thermoformed on 3D models. So the model is 3D printed, okay, and on that the sheets which are made up of this following material, that is TPU, is thermopressed to form the aligner. Okay, so just remember, अगर directly printed aligners पे आ रहा है question 3D printed, तो there are the shape memory aligners. जैसे नाइटाई होती है shape memory wire, वैसे aligners भी आते हैं आजकल जो है shape memory aligners, but the plastic or the material itself has some inbuilt shape memory to regain that form. Okay, aligners से related important type चीज है use of intraoral scanner and उसकी image. So for aligner manufacturing we need an intraoral scan of the teeth of the patient. So just look at the images of the intraoral scanner and remember them. उसको LED लाइट की ओर से कंफ्यूज नहीं करना कि एक इमेज आए जिसमें एक वॉन्ड जैसी चीज पेशेंट के माउथ में है इन यू टिक इट्स LED लाइट की ओर. ओके, तो ये हो चुका है, दैट्स व्हाई आई एम हाईलाइटिंग. जस्ट रिमेंबर इंट्राओरल स्कैनर, उसकी इमेज, related to aligner, the materials used for aligner manufacturing, how are they manufactured, how are they done. Okay, so again I am repeating PYQs of the last 10 years. जब separate exam थे एम्स PGI के तो उनको include करके start from the latest go to the back. 2025 में हो रहा है तो till 2015 should be thorough. Once you are done with this 10 years, then pick up SR questions, not before that. एक बार ये थॉरो हो जाए, then only pick up SR questions, and again SR questions will be latest to back. अब लास्ट आई थिंक 5-6 years are more than sufficient. उसमें भी जो थोड़े easy या level टाइप के, don't go for hi-fi values or study based question. If you have any question, you can directly contact your respective faculties to solve those things. जितने हैं go through them. किसी के पास नहीं है, you are not able, ऐप पे सब प्रेजेंट है, नहीं है, don't panic कि ये नहीं मिला वो नहीं मिला and all that. Whatever you have, go through them, notes, PYQs first, and third, when you are done with all this, then only go for SR question, not before that. It will be a complete wastage of your revision time and all. Okay, I hope this session was informative and fruitful of your time. Again, I'm telling, don't believe or trust on misinformation on social media and start signing petitions and all that for postponement. The authorities are well versed with the current situation and will take a call accordingly if they wish to do that. Okay, so I hope everyone, all of my viewers are safe and sound, living in certain sensitive areas as well, and are able to focus your studies. Okay, so that's it from my side. If anyone has any doubt, you can contact me directly, message, we'll be happy to clear it. Okay, so thank you and good evening.